And UN medical scientists say an astonishing 99% of the world's population breathes polluted air that exceeds internationally approved limits, with negative health impacts kicking in at much lower levels than previously thought. We have more in this report.
According to the World Health Organization, low and middle-income countries still experience greater exposure to unhealthy levels of particulate matter compared to the global average, but nitrogen dioxide patterns are different, showing less difference between high and low and middle-income countries. The agency's data indicates that 4.2 million people die from exposure to outdoor air pollution, in addition to the 3.8 million whose deaths are linked to household smoke produced by dirty stoves and fuels. And based on WHO's mathematical modeling of available air pollution data from 80% of the world's urban areas, it indicates that almost everyone faces an increased risk of heart disease, stroke, lung disease, cancer and pneumonia. As depressing and as dangerous as the situation is, the United Nations Health Agency insists that momentum has been growing for better air quality everywhere the last decade. Welcoming the increasing number of cities that have begun to measure air quality for the first time, Director of the WHO Department of Environment, Climate Change and Health, Dr. Maria Neria, said it was particularly significant that data is also being gathered on nitrogen dioxide.
We are very pleased to launch this report containing 6,000 cities monitoring now the quality of the air we are breathing. Maybe we can say that 6,000 is not enough. We have many cities around the world, but compared with what's happened in previous year, this is a very important increase on the willingness by cities to measure the quality of the air we are breathing. The bad news is that when we look at all of this data, still what the data is telling us that a big proportion, almost 100% of the global population is still breathing air that is not, that exceed the standards recommended by the World Health Organization.
With this database, we cover about 80% of the urban population worldwide so far. And the other good news is that within the last 10 years, countries have really recognized air pollution as a big issue because it has really raised on the international agenda. Exposure to air pollution has been recognized as a Sustainable Development Goal indicator. This is one important indicator that countries are monitoring more and more.
Proof of this is the fact that more than 6,000 cities in 117 countries now monitor air quality, compared to 1,100 cities in 91 countries a decade ago. Achieving cleaner air is one of the 17 Sustainable Development Goals, and an increasing number of UN agencies have passed resolutions urging member states to address the health impact of smoke-filled air.